to the nurse's station.
Lawless country people are real close family. Lately, some of my kinfolk don't get around too good, you see. When that doctor asked them, son, how'd you get in this condition? They says, hey, soft bones, I'm just carrying on an old family tradition. They wanna know, Doc, why do you think I got some pain in my joints from years of playing hard in this life that's too short? When that doctor asked me, son, how'd you get in this condition? I says, hey, soft bones, I'm just carrying on an old family tradition. Yeah, yeah, yeah. Tell me all about it, Doc.
Hey everybody, welcome to Hey Sawbones, my story, my passion. Dr. Ryan Molly here, orthopedic surgeon, cutter of bones, entrepreneur, business owner, most importantly, loving husband and father of 3 very young and busy boys. And today I have a very special guest. Really been looking forward to this episode. I think you guys are going to gather a lot of information from this. It's an incredible friend, but also a colleague. She is an internal medicine physician right here in Erie, Pennsylvania, and just has a great life story, has a great husband, 2 great boys, and just so excited to share this story. And without further ado, Dr. Archana Anand, how are you?
I'm good. Thank you for having me.
Yeah, so we've been talking about this for a while,
Yes,
right? And
yes.
it's good to finally get you on. And what we always do when we first start these episodes is people want to hear about you, kind of like where you're from and kind of your upbringing, a little bit about your family, your parents, siblings, what kind of drew you towards your career of medicine, and kind of your path along the way with maybe undergrad, med school, and your jobs. So let's hear it.
Well, my name is Archana. I'm from India. So I guess most of my friends know that. They call me Arch. I was born in a small town in rural North India. It's a farming town. Most of the people are farmers. My dad's family, so there were 5 brothers, sisters. Only my father went to college. So everybody else, they still have farmlands, the same area. So population less than 40,000 at the time. It was a very small town. Not too many options when it comes to schooling, like good schooling. Of course, there were schools. My mom is a teacher, was a teacher at the time, and my father was a lawyer. I grew up with 2 brothers. I was the middle child, only girl.
The rose between the thorns, right?
So yes, I did get a lot of special treatment, especially my dad. I had a great relationship with him. Like, he would buy me snacks behind my brother's back. He would hide them and then give it to me later.
Sounds like favoritism.
Yes, it was slightly, yes. I miss him. But at the time, like being from a small town, my parents, they were educated. So they wanted a better school for us. So in India, like 3 hours drive from where I lived, we had this nice elite boarding school where you need an entrance to get in. That's what my parents decided. My older brother and I, we did the entrance. The entrance had a written exam, a physical exam, and an interview. And they were 4 weeks apart from each other. So it took 3 months.
Wow.
So the preparation, I still remember preparing to get into that boarding school. And when I reached the interview stage, the principal at the time asked me, one of the questions was, what do you want to be when you grow up? And I wanted to be a pilot at the time. So pilot was always, I think it was just the heroics you saw with it.
Yeah.
And it just seemed great. And,
Were you
and I
thinking
still,
like commercial airline pilot or?
No, I wanted to go to Air Force, Indian Air
wow.
Force. Yeah. So, just starting like childhood, yes, I had different goals. And I was 8 to 9 years old when I started my journey at boarding school. That was 4th grade for me. And this was a sports school. So the focus was, I would say 60% sports, 40% academics.
Oh, wow.
So our mornings started pretty much waking up at 5 with the whistle in your ears. It was, yes, old school, like whistle, loud screeching whistle. And then, so before we started school, we had an hour and a half of sports. So for me, we had to pick a game, like a sport. So for me, it was swimming. Followed by school. Then again, we had like homework, everything till 4. After that, again, sports. So, and you were only allowed to pick one sport. So we pretty much did 3.5 hours.
Oh, wow.
Out of that 1 hour, you could count as, some conditioning, running, exercise.
Sure.
But at least 2 hours of one sport a day.
Wow.
So
how many kids were in a class?
So we had like 4th class had 3 sections to it, and each section had about 26 kids.
Okay.
So I would say about 75 to 80 kids.
For your grade?
For one grade.
Okay.
Yeah. Yeah. But very like that, I feel like those are some of my best years looking back. Although the first 3 months, I hated my parents. It's like, why did they send me here?
Yeah.
Just homesick.
Were you there from 4th
until 10th grade?
Okay.
Yeah. So again, that's the time I felt I developed this. I didn't like sports at the time, but I think that just developed my habits.
Mm-hmm.
Waking up, like made me a morning person, basically.
Taught you discipline.
Exactly. Yeah. So that's even now, it does not need a motivation for me. It's just a habit.
Yeah.
I don't feel motivated every day, but if I don't do it, then it just doesn't feel right. So my older brother was there with me. He was just a year ahead. After like 10th grade, 11th and 12th, I moved closer to be with my parents. So unfortunately, like sports does not have a good future in India, as opposed to if I did the same level of sports here, I feel I would have done like well.
Yeah.
Because in India, I made it to nationals. So I represented my state. Now, if I did sports at that level here, I feel I would have gotten more out of it or more opportunities
Sure.
to play later in college.
Yeah.
But after 10th grade, it just abruptly stopped. Wow. Because then, especially in the culture I grew up in, it's very important to have a degree, like a doctor or an engineer or something on that level. So my parents were, okay, after 12th grade, you have to do this common entrance test. That's what you do for med school. So you can go to med school right after high school.
Okay.
You don't need the 3 years of college. No.
Now, how long is your medical school training?
So medical school would be 5.5 years, including 1 year of internship.
Okay.
So after the 4.5 years of med school, you pick the internship. You are required to do part of it in the rural India to get that exposure, and then the specialties of your liking, basically. So 11th and 12th were the years where I felt really suddenly stopping sports. I didn't realize it at the time, but I felt, looking back, I wish I wouldn't have done that, because suddenly those 2 years, I put on 20 pounds almost, more than that, maybe, because it was all about studying and just academics completely. So started medical school, and I didn't feel good. So I picked up again my like thankfully there was a gym nearby. I started going again. So
Were you
I'm
swimming
just,
again or just?
No, unfortunately there was no access to the pool.
Okay.
But I just got into other activities like running more so,
Okay.
and resistance training, weightlifting. So after med school, I did about 2 years of work, maybe 1 to 2 years again in rural India. I was still deciding what I wanted to do because the postgraduate there, which is similar to residency here, it's, believe it or not, is much harder. There are about 30,000 postgraduate seats in whole India, and there are more than 2 million kids applying for that.
Oh my goodness.
So it's much more competitive.
Is that general medicine?
That includes MD, MS. MS would be surgery, and then after MS, you super specialize. What else do you want to do? But
Sure.
basic would be the MS,
Wow.
and then the surgical specialties, just like here,
Yeah.
general surgery, and then you specialize.
So how many years of residency did you do there?
So no, I did not do residency there. So I was, like I said, I was still deciding between, after my med school, actually you could work there. So I was just working for a year. And then
What were you doing?
I was working in a hospital, like a rural hospital, as a general, like a practitioner, as you GP, as you would say.
So you were able to do that before
Yes.
doing a residency.
So you can do that with that degree. What we call that, like here, med school, there we call that MBBS. So which is Bachelor in Medicine, Bachelor in Surgery. So that's MBBS. That's the, so you can still practice even after MBBS because you have enough training to do that.
Got it.
But then I saw my brother, I saw what he did. So my older brother is a physician as well. He did his USMLEs, like part 1, 2, 3, came to New York. So the pathway was very clear to me what he did. It was just clear, like, okay, I have to do this part 1, part 2, then come to US, do the step 3,
Right.
apply for residency. It just seemed so much more well-defined. It's like, okay, this is what I'm going to do. It's easy. I know the books which, to read.
Yeah.
So that's how, it's like I said, it was easier for me to do that than doing the postgraduate in India.
So 2 years after your medical school there, you worked, then you moved to the United States.
Yes.
And were you living, studying here for that, or were you doing all of that over in India? Like before residency?
The USMLE step 1 and 2, I did while staying in India.
Okay.
So I could study there, do the exam online.
Sure.
The step 3, you had to come here because that's the clinical assessment.
Yeah.
So I did do that. I came on a student visa. At the time then, my brother was in New York. So I stayed with him. I could apply for residencies at the time after my step 3. So my residency then, so during all this time, I had also already met my husband and he was in Pittsburgh. So of course my residency focus was Pittsburgh.
I'm going to save my, how did you guys meet for the personal question? I'll give you a heads up.
Yeah, sure. No problem. So applied for residencies, came to Pittsburgh. I wanted to do OBGYN because in India, again, OBGYN for a female is very respectable. Though personally, I never enjoyed that blood. It was always made me queasy.
Sure.
But I got an opportunity to do an observership at the OBGYN department here, West Penn Hospital. That's where Anand was. So I didn't do well.
That's how you guys met? Or?
No, I already knew him before.
Okay.
So the observership, I hated OBGYN. Just, yes, the baby is great, but I just couldn't do it.
You do not need to explain it to me. There was a lot that I was able to check off the list before I even did the rotation.
Although I did get to know Anand better during that time. Yeah.
Was he an attending?
He was a 4th year.
Okay.
At the time, yes. I hated the nights because I don't know how OBGYNs do it. Like they can sleep anytime, they can wake up anytime. It's
they're
difficult.
living by the pager, right?
Right. I feel trauma and OBGYN are most difficult.
It takes a very
specialties.
special, unique personality to do that.
Right. And just the calls, staying 24 hours in the hospital.
No, not for me.
That's, yes, same. So at the same time, I did family. Actually, I got into family practice residency finally at the West Bend Hospital. It was just easy for me. Anand was there. I got in. It was great. Close. At the end of first year, the family practice residency at West Bend Hospital lost its accreditation. It closed. The program closed pretty much. So,
Oh, wow.
So we were 5 of us, I believe. I don't remember exactly. Yes, but we were 5 of us, and suddenly, so this is post-match now because you can't. Applications are already done.
Yeah.
And so I'm applying through post-match scramble.
Yeah. I was going to say the scramble. The dreaded scramble.
It's so stressful. So I still remember I'm at the house. I've pretty much lost hope here. I'm like, okay, doesn't look like what I'm going to do is just take this year off and then reapply next year. Just then my older brother, he was also looking for a spot for me. He's like, okay, I see there's an internal medicine spot at Allegheny General Hospital. That's like 6 miles from you. Okay, I've already applied there. I didn't hear back. Like, okay, I want you to just go in. Just go. It's like you're in Pittsburgh. Just go there.
Walk in.
Yes. So
I like your brother because that's what I would have told you to do too.
Yes, I mean, and that's the only reason I went. Yeah, he's great. So he pushed me. I took my folder, all my recommendation letters, everything in there, and
You brought your tent, and you were like,
yeah.
"I'm going to camp out here
Yes.
until you accept me. I'm going to bring a camp firewood in here. We're going to do s'mores.
Yeah, and
Eventually, you're going to accept me."
So thankfully, it didn't take that long, but I went there and Patty, our residency coordinator, that's the first person I met. She's like, okay, Dr. James Riley, our program director, he was rounding. So she's like, okay, he's rounding. You're welcome to wait here. He walked in, he crossed me, like I'm sitting, he crossed me, went to his office. And then 5 minutes later, he called me. I'm so nervous. Like, okay, I'm meeting the program director. Here's my folder. And I explained the whole situation to him, what happened. It's like, okay, Archana, welcome to the program. That's all.
That was it?
That was it.
So you were nervous for that?
I was so nervous. And
Well, you didn't know it was going to be that easy.
Right. I didn't realize that's all sometimes you need to do is just take the action. And,
Yeah.
and it's just a story. Like I always look back because that changed my life at the time. Just that 1 hour, because here I am sitting in my basement at home, just being like down on myself. And if I had just not gone there, like really, I would have been, I don't know.
You would have been taking a year of
Right. Yeah.
working at Starbucks. And
Probably.
I love the fact that you kind of pointed that out, like action, right? So there was a Steve Jobs, and I'm not going to quote it perfectly here, but I saw a quote where he was just talking about, 95%, I don't even remember the percent, but it was a very large percent of the time people don't succeed because they don't ask the question. They just assume it's a no.
True.
The spot's already filled, the this, to that. He goes, if people just, it's like paralysis by analysis. Like you can keep, oh, this isn't going to work out because of this, or this isn't going to work. You can be a Debbie Downer. You can be a glass half empty type of guy. And then, but just going in there.
I think I've read that story. He called the HP CEO and asked for if they had any extra parts. I mean, Steve Jobs.
Yeah.
And I don't know if it was Mr. Hewlett or Packard, I don't know, but they laughed at him. They sent him the parts and also invited him, he was a high school kid at the time, to do an internship.
Oh, wow.
So I've read that story that he...
I didn't know the backstory behind that, but...
Yeah.
Well, you thirsty?
So, yes.
So I know, so Archana is doing, and I want you to kind of explain it, 75 hard, and she's on day 74.
74.
So one of the things is no alcohol. So tonight you're going to have a nice,
perfect.
refreshing Lime
you.
Perrier.
Thank you.
Okay.
Yeah, so 75 Hard is one of my friends was doing it. Actually, he's my inspiration on this. You might know him, Brian Gilday. He's from Meadville.
Know the name.
Gilday construction
Okay.
thing. But anyways, he
Cheers, by
is
the way.
my cheers. Let me open this. All right.
Nice and refreshing.
Tastes great. Yeah. Thank you.
Mm-hmm.
So he was doing it, and I needed, by the way, I was training for triathlons. This is our triathlon group, the Erie Triathlon Group. That's how I have this nice, great group of people I train with. Supportive, everybody. You know, whenever we find time, we swim together, run, bike together. But when I saw him doing it, I felt I needed, I call it an organized disruption in my life.
Okay.
I needed that because it was all about weekend socializing, drinking, next morning waking up with a headache, wasting time in the morning.
Yeah.
So the one day is just gone when that happens. So I did need that. So it involves 2 45-minute workouts, a gallon of water a day. You have to read 10 pages of a nonfiction book. It cannot be a podcast. You have to read 10 pages.
So no audiobooks.
No audiobooks. No alcohol, cheat meals.
It's all natural food too, right?
Right. You have to follow a certain diet, but it does not focus on weight loss.
Right.
You just do what I felt. For me, I felt I was not getting enough veggies. So just tried to make it healthier. I felt I was already eating healthy. But for me, it was more for mental strength and just staying off, following something through. And so I've really enjoyed doing it. I might even stick with it.
Wow.
it's
She's
great.
day 74. My PA, Jake Snyder,
Yes.
he did 75 Hard along with his sister and I think a couple other people. And as I
Okay.
was telling you beforehand, he actually incorporated an ice bath into it.
Wow.
And he was doing this in the middle of
It was
winter.
not hard
I think
enough.
he started like January. It was probably like a New Year's
Yeah.
resolution type thing. But
Yes.
so you've watched at least 1 or 2 episodes, right? I think you
Yes.
saw Dr. David Hutzel's and Dr. Matthew Zim's.
Mm-hmm.
So you're my 3rd physician on here. I've had almost as many attorneys as I have physicians.
Really?
And at one point I had more attorneys than physicians. But one of my favorite things about this project is that it's all walks of life. Last night I recorded an episode with one of my dearest high school friends, Ryan Ray. He runs, he ran an engineering department, but also runs like a manufacturing department now
Oh, wow.
himself. And
cool.
we were high school buddies, but as you know, we do a Q&A session. It's kind of a mutually beneficial type of interview process. So you're going to ask me 6 questions, 3 of which are business, 3 of which are personal, and then I'm going to do the same back to you. The one thing that I always tell all my, guests that come on here is you do have the opportunity to veto one question if you don't like it, but you would go down in history as the first person to ever veto a question. So no pressure, Archana. So,
Right.
you ready? You're going to start
I'm
first.
ready.
So business questions.
Okay. Well, as you and I both know, like this question has always it's bothered. All physicians go through this, but physicians have some of the highest stress in their lives. I mean, there is such high rate of depression, actually substance abuse, suicide rates. It's so high.
Number 1, did you know that we just
Right.
took the number 1 spot? Highest suicide rate in the United States by profession is now physicians. It was dentists for a long time. And do you know who has the highest suicide rate amongst all those physicians?
No, I did not.
Unfortunately, it's orthopedic surgeons. 28% of physician suicides are orthopedic surgeons.
Oh, wow.
Almost a
that's
third.
That's hard to believe. Really? Mm-hmm. It's such a sought after specialty too.
Yeah,
that's-
I don't know the rationale behind that, but I literally just read that article 2 days ago. So, but I'll let you finish your question. Sorry.
Yeah. So, but I felt like you have been in an employed position after fellowship, I believe, although for a short time. And you have your own like private setup now. How do you feel it's daily stress. We live in such an angry world, uncertain, litigious. Like, how do you feel you protect your practice or yourself or your your partners from that burnout?
Yeah, that's great question. I'm not going to say I have all the answers, but I think for me that the easiest way to answer that is to say that I absolutely love what I do. So, there's again, I'm into big quotes and things like that, but and I can't remember who it was. It may have been Walt Disney or something like that. That basically was saying, if you dream it, you can. If you believe it, or if you dream it, you can do it. Type of thing. And for me, if I can just go to work and look forward to it every day, I think the burnout rate is significantly lower. So, real quick update. So right after fellowship, I was private practice for a year.
Okay.
In Michigan, flipped over to an employed physician model for years 2 and 3. Then I was so miserable, flipped back into private practice. Same practice. I never actually left my practice. I still had. They weren't technically business partners, but we were more collegial partners.
Right.
3 other orthopedic surgeons. They were owners of the practice, so I still stayed there. They made out well because they would get financial support from the hospital for rent as well as staff. So it really reduced their overhead significantly. They paid for x-rays and things like that too. So it made sense. They were, I think, disappointed when I chose to do that. And then when I realized that the grass was not always greener. And for every physician, I think it's very different. Depends upon your personality. And I learned very early, literally like probably week 1, that I was not employable. I'm too far off the reservation for that. I think there's multiple reasons for that. Number one, autonomy is probably one of the most valuable things to me. And control, right? Being able to kind of do what you want to do and treat your patients the way you want to treat it, because that's how I would honestly recommend or treat my mom or my dad.
True.
And then just to be pulled into somebody's office and sat down by an administrator and be told like blatant lies of you're losing us money. And I'm like, all right, I'm not stupid. I wasn't born yesterday. I'm not an accountant, but I know that my service line makes your hospital tens of millions of dollars per year, right? So it was just some brainwashing. I didn't like the fact that I felt there just wasn't trust. There wasn't trust. I think it probably both ways, right? Like once they realized that I was kind of like a headache for them, they realized that, okay, it's hard to trust him and vice versa. But I mean, they were trying to kind of cheat me out of RVUs. And for those of you that don't know what an RVU is, say my mom's watching, RVU stands for relative value unit. For each type of either procedure, or if you're seeing a patient in the office, you would be allotted a particular RVU. Say like a total knee replacement would be roughly maybe 25, 26 RVUs. Seeing a new patient consultation would be probably a fraction of a percent, or a fraction of an RVU. But then for each subspecialty, you get paid a certain dollar amount per RVU. So that and most physicians are salaried, right? Employed. And then they have productivity bonuses based upon RVU. So that didn't work out. So long story short, went back to private practice, took a massive pay cut. Literally, I went from making this to 1/3 of that.
See, that step right there, that I feel was a huge step. Like, I feel that's the biggest step right there.
I didn't even bat an eye at it.
For someone to do that, because that's really it. Like, if you're able to do that and go through that hard phase, like you built everything up from zero.
We had 2 young boys at that point, but we weren't living outside of our means, right? We had a modest home. It was very nice, don't get me wrong, but we got a really good deal on it. It was a short sale. It was in a beautiful neighborhood. We were close to Karen's mom and dad and cousins, and definitely not living beyond our means. And I went to Karen. I was like, listen, she knew how miserable I was. And so I could have told her, I'll make 1/10 of what I was making. And she would have been like, we'll make it work. right? So when I came to her and said, hey, this is what I'm thinking, but here's this. But I said, if you just trust me and believe in me, I know I can do this, and I can take this and grow this into something that will be, and I'm not talking money, right? I'm talking like building a vision, a product, and along with that comes the results. But when you focus on that as like your driving force, people always generally end up unhappy. So I think that's another reason that I have been able to be mentally healthy. And I'm not going to say that I've not struggled with little bouts of, mini depression or this. I think every person does.
For sure. Yeah. But I see what you mean. Like the way you are doing things, you're able to control the pre-op at every like touch point with the patient through the surgical area, post-op. So you are controlling all that, or you're preventing anything bad from happening. And that's what patients love about it too. Like you have like an orthopedic spa, I feel.
Yeah. And it was just painful. Like, in hospital employed models, it's like trying to you're on the Titanic. You're trying to steer to avoid the iceberg. Yeah. It takes a long time to turn that big of a ship. It takes that long of a time to steer a big hospital, big organization. If you said, hey, I want to start doing this. I think this is like hot, like outpatient surgery, right? And no hospital that I've ever been affiliated with was a huge fan of it, because to them it meant less dollars. But to me, it was better for the patient. It was lower chances of infection. People recover better at home.
Absolutely.
Right? So
actually on the same line then, my second question, I see a lot of patients, and every orthopedic surgeon I feel has a different way or protocol of doing things. But I see some of your patients, actually most of them, I've seen them on bed rest after a joint replacement. And I don't know how long. Is it 1 week, 2 weeks?
3 weeks.
Okay, 3 weeks.
No, it's not like 100% strict bed rest.
Okay. But I just want to understand, of course, as a physician myself and for others' education, is there, like for that delayed ambulation, what are the benefits for the patient?
Yeah. So I wouldn't call it delayed ambulation. I would call it more soft tissue rest. And I'll explain. All right. Okay. So the first 4.5 to 5 years of my practice, I practiced what was called rapid recovery protocol. Okay. It's pretty standard of care 15 years ago, even to today. That's like what people would call the standard of care, where you do a joint replacement. And I don't mean like, do they go home the same day or the next day or a couple days later? It's more like what you're doing and how quickly you're doing it. So I was getting people up, getting moving quickly. You were going to outpatient physical therapy within 2 to 3 days of your operation, and we were doing that 3 days a week. I got people back to work much quicker, usually within 3 to 4 weeks. But when the patients would come in to see me, you have to remember that's all I knew from my training. I would see the knee or I would see the hip, and it'd be really red, hot, inflamed. It wasn't infected, right? There was no drainage or anything like that. And it was stiff and it was painful and it was just tight. Everything was just very tight. And those patients were miserable. And I just said, well, hey, sorry, man. Sorry, Archana, that's a total knee. Welcome to the club. Okay. Moved to Pennsylvania, met Phil Frendak, my associate.
Right.
And he was a physical therapist before he was an orthopedic surgeon. A lot of people don't realize that.
Oh, wow.
So he has a very unique perspective on things. And I kind of knew that he was very delayed with his postoperative regimens. So I just sat down and we were just chatting, as we would often do and still do. We'll sit down and text or grab a beer and just talk about what's new. We'll go to conferences together. So he's an awesome partner. By the way.
He's great. Yes.
He's like Batman though. It's hard to get a hold of him, and he's like under the radar, but love you, Phil. And he said to me, he goes, Ryan, if you could take a total knee patient, put him in a body cast for 3 months, take the body cast off, their knee would do amazingly well. It may be a little stiff for the first couple of days, he goes, but the motion would come back quickly. There would be very little, pain for the patient because they're not using it. He goes, the problem is they probably wouldn't survive 3 months because they'd be bedridden. They get bed sores, they get pneumonia, they get DVTs, blood clots in their legs, urinary tract infection, all those bad things.
Right.
So his process to me is like, you gotta allow the tissue to rest after the operation. So the way I kind of explain this to my patients is, say you break your humerus, your upper arm bone, or you get a huge gash in your thigh with a machete. You would not wake up every day and start moving your arm around and trying to get motion at that fracture site. And you wouldn't wake up every morning and start to try to work on scar mobilization, because you would rip it open, it would start bleeding again, it would fester, and it would never heal. Or think about if you had a huge bruise. Would you wake up every day and punch it?
True.
Right? So that's what we're doing. We're creating a huge surgical insult. By the way, there's no arthritis pain when it's done because we've replaced it with metal and plastic. So any residual pain after that operation is 100% soft tissue and surgically induced.
Yeah, and the patients are doing great because we personally have a lot of these patients as in our practice.
Yeah, mutual.
So they're doing great.
So what we do is we lay them down flat on their back 80% of the time for the first 3 weeks with their feet above their heart. What it does is it allows the swelling to reduce, helps with DVT prevention too. Most people think, are these people getting blood clots at astronomical rates? I don't remember the last patient that I had that got a blood clot. So
that's great.
So it's different. And then we start physical therapy for our knees. For me, I start them 4 weeks after the operation. So you allow the soft tissue, inflammation, surgical insults to subside, and then you proceed.
That's great. That's great.
Yeah.
That's like I said, every ortho that I see has a different
Protocol.
So, and like I said, this is working great and makes so much sense as well.
Well, and just to finish up real quick. So I had the beauty of seeing both, right? So did it kind of the old school / current standard of care way. And then when I changed it, I'm like, oh my gosh, these patients are coming in, their knees not red or rarely red. Yeah, it's a little painful. People will say they feel like there's a band across the front, but it was nowhere near as inflamed. The knees move significantly further and better and easier. And they're just much happier patients. So
that's great.
That's the key, right?
And learning from your experience too.
Yeah.
That's great. That's great. I mean, I feel that's what all these, have you submit research projects? Like, do you do any research projects in your practice? Because all these patients are your own patients.
Yeah.
So I'm thinking, like, would it be easy to submit, or is there data already there about this?
We haven't done any research projects about that. I think it would be very unique and very exciting because it is a unique protocol. Right. We do research though. We have a research coordinator. Most of it is around like implant related. Like I designed along with 3 other surgeons a partial knee replacement system, and we created it. We were the creating surgeons, and so we're doing follow-up studies on that. We're over 5 years now with that particular implant.
Is that the same? I read something about the Soto.
Moto.
Moto.
Sorry. Yeah, Moto. So that's the Medacta Moto, which in Italian means motion.
Okay.
So
but aren't you one of the doctors who?
One of 4. So myself, I'm going to give some shout outs here to my boys. Mandume Karina, he's out of Leesburg, Florida.
Okay.
My buddy Akbar Nawab, he's out of Louisville. And then my good buddy, Dr. Tony Robbins, he's out in kind of the Seattle area.
Oh, wow.
So we're the
great.
only Medacta design team that is all US based. Every other project they've ever had, because they're a Swiss based company, they've always had, we'll have an Italian surgeon, we'll have an Australian surgeon, a couple of US surgeons, a German surgeon. So it was a unique project. And I've worked on a couple other projects. I'm currently working on a global partial knee system project. So like the next version of that. But there's, I think, maybe 12 of us. And we have Japanese
amazing.
surgeons at this.
So in addition to what you're doing, you're also working on newer innovations here. That's great.
Yeah.
Great, Ryan.
So I think that's probably pretty good for the business questions.
Yeah, I don't know if you would count this as a personal or business question, but I am really curious. And I know you told me the story about even before you started your practice, I think you shared the symbol, the Whole Health Orthopedics.
So
and
this is not the whole health tree.
But
there's a lot of trees in my life and in my businesses. So I have quite a few businesses. The whole health, it's funny you bring it up because literally one of the first and maybe only times, maybe 3 or 4 times, I've had a patient ask me about the logo It was just last week. I said, when I was done with my consultation, like I went through the whole thing, what to expect after your knee replacement.
Yeah.
Any questions? And the wife goes, I have one. And she points up at the TV screen because each exam room has a TV constantly streaming educational information. She goes, what's the story behind the tree, the logo? And I said, well, Whole Health was not necessarily an orthopedic surgical practice. It was originally a wellness community that my best friend Jared Oakes and I kind of conceptualized back in 2013, 2014. We both decided that almost like your 75 hard kind of like thing that you've done in your journey that you've been on. We both were kind of looking at our lives at that point. I'm year 4. I just went back into private practice. So I'm like feeling very entrepreneurial, very powerful. I'm just like, I got this. I'm controlling my destiny. And my best friend Jared, who's a real estate attorney in Cleveland, said, hey, and it was like, I don't even remember the venue, but we're like, man, we could do so much more with our lives than me putting metal and plastic in people and him closing big real estate deals. And we're just talking about the problems of chronic disease in the United States, whether it's obesity. I mean, I don't need to tell you, but diabetes, malnutrition, smokers, just all these bad habits. And we said we could create a community that really focuses on health and wellness. And it had every component. It had real estate for Jared. It had a medical community, which I was kind of the chief medical officer of. But it also had the sense of like farm to table nutrition. We had emphasis on early childhood education. It wasn't like a school per se, but like preschool.
Yeah.
And you would live there too. There was homes and
it's great. I mean, I don't know if you remember how I first met you because
I remember.
Really? Oh, you remember?
Oh, was it in this neighborhood?
No, Iroquois Club in Conneaut Lake. That's where I first met you and Karen.
Okay.
And you had already, you were already at the hospital, and Anand already knew you. So you were sort of that mentor relationship. And I remember you guys laughing, and you were talking about this at that time. The whole health or wellness, and because I've known you before you started, like your practice,
sure,
like your private practice. And it's just the same vision you're telling me right now. I remember seeing
this was a massive scale. We were looking at properties, 500 acres. I mean, the project budget at that time, which is 10 years ago now, was $292 or $293 million. So we weren't going to fund it. We needed to get, angel investors, venture capitalists. So we created a business model. We had all architectural renderings and like visions and handbooks and financials. And we sat down with multiple people to kind of pitch this idea. Everyone loved it, but it had never really been done. So people were scared. And I think they were like, who are these two young dudes? Like, stick to orthopedic surgery and stick to real estate. And then just to answer your final, the actual logo. So I sat down and I just started drawing. I needed something meaningful. I was like, all right, it needs to be something that promotes life, wellness, nature. I was like, what better than a tree? And then I was like, it needs to kind of look like a person, right? So arms open up, like embracing with the head, the circle. And then the roots needed to be strong and profound. They needed to be very big. And so I drew out several iterations, and then I had, and I just found them on my phone scrolling through it. It's like, there's a lot of ideas I had, but it eventually kind of solidified on that. And then as you see, this is the tree on Lyona Road, which is about a half mile from my parents' house.
Oh, so really?
It's actually, and it's the symbol on the cover art for the podcast. So there's a beautiful sunset.
Okay.
I actually took that photo last fall while archery hunting. And I went and I was like, holy cow. So
yeah, that's great. I mean, this is amazing. I'm so proud of you, like proud of calling you a friend.
Well, thank you.
It's always such an inspiration because from the time, like I said, I've known you before you started practice and you were talking about it. Not too many people realize, I feel, their vision.
Yeah.
So you've had this vision for such a long time. So
yeah, and
it's great.
I've been guilty, and Jared's been guilty of like dreaming big, really big. And both my wife Karen and his wife Jill, both Michigan girls, they were like, "Hey guys, do you think this may be a little aggressive?" We're like, "What do you mean? Like 500 acres is too much? $292 million is too much?" And they're like, why don't you just start in little, and Karen's like, just start with little projects. I'm like, that's not how I work. Go big or go home. And, but then when I decided to do whole health, it was originally called Joint Replacement Institute because that's all we did, hips and knees. Now it's Orthopedic Institute. We changed the name, but it was a mini version. I kind of took Karen's advice, and it was a mini version. I asked Jared for the permission to use the name because it was our idea, the whole thing together. And he was like, dude, I'd be proud for you to do that.
Yeah, that's great.
So
Great.
what else? What other personal questions?
Okay. I know I've had your pizza. Amazing. So, but normal day to day, like, who does the cooking? Well, you?
Yeah.
Really?
So
that's
I'm
great.
trying to say this politically correct. Number one, I enjoy cooking. To me, it is like, it's like mowing the lawn. To me, it's kind of mindless, although cooking can be stressful, especially when you're doing a lot and you have to time things out.
True.
But I love projects and I love that distraction. But it's like, okay, I do my work. And most people are like, you just want to come home and like have food on the table. No, I cooked dinner last night. I cooked dry aged Angus ribeyes. I did these amazing, I call them Molly's rustic potatoes. I diced up red skin potatoes, some onions, some
Sounds great.
peppers, olive oil, garlic, butter, and I throw it in the pizza oven. So it's a big process. But so I did that for my buddy last night, Ryan, who was on the podcast, and did some ribeye steaks and then broccolini. Tonight, I did like a rustic style pasta. So I stopped in Conneaut Lake. Do you know that little butcher right there? Help me, folks. Right there across from Silver Shores. Milady's was in Meadville.
Okay, I should know, but
Yeah, I feel bad. I'll stop in there from time to time because coming back from the hospital, which is in Transfer, Pennsylvania, I come through like Adamsville and Conneaut Lake sometimes. So I stopped there. I grabbed some Italian sausage. I had some tagliatelle noodles, and I put that all together. You got to put garlic in there. Right? You have garlic, some onion in there too, and the boys. And I made it spicy. Do you like spicy food?
No, not so much.
Which is
Indian
a little
food
atypical,
is quite
right?
It is. Yes, well, most of my years were in boarding school, frankly. So I did get used to because the food is made for so many kids.
Okay.
So I really didn't get used to spicy food.
So yeah, it was kind of bland.
Right. Yeah, but for some, my brothers love it. You know, they like my most of my family members. I mean, they love spicy food, but I just can't.
So I added some heat to it too. I mean, it was already hot Italian sausage, but I added some cayenne pepper. You got to put some cayenne.
Can I ask you one more question?
Yeah, one more, and then we're gonna turn the table so I can ask you questions.
So if you were before you started your practice, or to a young doctor, orthopedic, or think of one of your kids as an orthopedic, you know, getting out in the world after fellowship, after residency, and if they want to start a private practice, what would you tell them? Is there one advice you would give them? Something that you personally, looking back, would not have done? Like anything like that?
So private practice?
Private practice.
I would say you need to think outside the box 100% of the time. If you can't, probably not going to succeed. And that's being very blunt, and that's being very painfully blunt for some people maybe. But you have to think outside the box, and you have to get creative to be successful. You need to figure out ways that are going to set you apart, right? Like, and just building your business, building your brand, which has been so much fun, by the way. Why should people come to Whole Health? Well, you want reason number one, or do you want reason number 101? Because I've got them all, and I can go down through them for you. But it's what makes us unique, and it's you got to do things differently. And to me, it's not just different just to do it different, but it's different, but also, in my opinion, better. Right? Whether it's our post-op protocols, the way we do our hip replacements, anterior minimally invasive. Kinematic alignment for total knees. We're the only people in this area doing that. You could travel an hour and a half any direction, probably 2 hours, and not find another surgeon doing that.
That's great. In your office, I hear like it's such a. I've been there. I've taken the tour, but from the patients when they tell me, it's like just everything is so like a well-oiled machine, sort of like everything is there. Like once you decide on the surgery, they know exactly what to do.
Yeah. So the key there is like you
great.
can't have too many cooks in the kitchen, and fortunately for me, all of the like I'm my own boss, right? So I own the practice. I let people practice the way that they want to practice. I'm not telling any of my associates, like I'm not telling Dr. Frendak or Dr. Milam or Dr. Sian, hey, you have to do so. I say we do need to agree upon some protocols, because when you do that, it's going to make it much easier for our staff. Like for me and Phil, one of our main things when we first came together was we have to make sure that we're 95% aligned. Yeah. This can't be, well, that's the Frendak way and that's the Molly way. We said no way. And he's like, I said, if it's that way, thanks, Phil, but I don't need you. And he said, Ryan, I wouldn't want it that way either, because I practiced that way before and it didn't work. So we were so 100% aligned on that. And that was kind of what we did. And anybody that's new that comes on, obviously I don't do shoulder, so I'm not going to tell Dr. Sian or Dr. Milam how to do a shoulder or sports medicine case. For sure. But for hip and knee stuff, we've designed like our protocols. And if you want to vary a little bit here or there, that's fine. But stay within the confines probably 95% of the time and everything goes well.
I mean, you guys are doing great.
So, well, thank you. You ready to turn the tables here?
Sure.
So, number one, your intro was amazing. I learned so much from you that I didn't really know. I knew that you went to boarding school. I didn't know you went that early. So, I mean, some of my questions have already been answered, so I'm going to have to think of some new ones, but I'm pretty good at on the spot type stuff. I guess my first one is going to be like what you do. You're an internal medicine physician, right? Mm-hmm. You kind of have a specialty or passion for obesity medicine.
Yes. Yeah.
And I know that you're very fit, conscious on your disciplines of probably working out regularly, probably eating healthy, and just like how you can be healthy, which is, it's hard to be overweight or obese and healthy. Maybe overweight, but obese. Right. So how do you approach your day-to-day, like coming in, putting my happy face on and making, because you asked me, how do I prevent burnout? How do you do what you do and hopefully help prevent burnout for yourself?
Right. So that's, working out, being active in the morning. That's my personal, I feel, coping skill for me.
Okay.
And it has to happen in the morning. Although currently, since I'm doing the 75 hard, it also needs me to do another workout in the evening, which is usually a walk for me. Nothing.
Just 45 minutes.
Right. It's 45 minutes. But my morning, I do need some form of movement. It could be even just a mat and stretching for me, like yoga video on YouTube.
Okay.
Or like a phone video, I just put it on. Just some movement has to be there. I love boxing. I still do.
Do you do level red still?
I still do boxing at least twice a week.
Wow. You going for the early morning ones?
Early morning.
Yeah.
Yeah. It's again, like I said, if it doesn't happen in the morning for me, unlikely it will happen.
What time is that early one? Because I did it for a while. So
5:15, that morning class. But that, I really enjoy, like I told you, the 2 years after during my high school, after 10th grade, I suddenly came home and there was a complete just cessation of sports or activities at the time. So I realized personally what that did. I was too young, but looking back, what that did to your mental health.
Just culturally, I want to ask this question because to me, say you're in that boarding school environment, you come home, like, why couldn't you just go out and run or swim on your own? It wasn't as structured?
So the city I was in, and actually, unfortunately, the roads, for example, they're not really runners friendly. You can't just put on a pair of shoes and go out for a run. Not safe. We didn't have, and I'm talking about 97, 98. We didn't have many gyms, especially for girls.
Yeah.
Not too many. My mom is actually very open, so she would not have cared. Like, it was not related to what my parents wouldn't let me, but there's just too not options.
Sure.
And plus, I was so much into that, okay, I have to clear this medical entrance test. I have to get into a med school.
So you were
So
shifting your focuses.
focus there, yes. But I just looking, so I do realize, because a lot of my patients, at least 60-70% of weight loss patients I have are females. And I'm not sure if I'm taking this question in the wrong direction, but I'll come back to that. But these...
The nice thing about this, you can take it any direction you want to take it because there is no script. It's just genuine authenticity. So
Right, yeah. But, this is related to burnout as well. But like these patients that I have, like I can see how much of their self confidence, the depression is related to what they see in the mirror or what they see on the scale.
that's a great point.
And if you were to say, like, ask them this one question, like, what's your happy weight? When was the last time you felt you were happy with your weight?
Are they linked up? Those
So right, and some of them never, like, they feel they've never been that weight. They've never been happy with the weight.
Yeah.
So it's always, first of all, it's always a struggle for weight for females, and then how much of that connection for mental health is there. So they've actually done studies that obesity comes first, followed by there was diagnosis of mental health diagnosis comes later.
That doesn't surprise me.
So right, and plus vice versa. It's such a vicious circle.
Yeah.
So when I see that female, I'm just giving an example. I'm seeing a 45-year-old female. She's doing well. 3 months later, she's 20 pounds down, 25, 30, and she's wearing this great dress. And, she's not hiding anymore. Like, she can fit into her favorite jeans. And when you see that smile, like, I feel that's my best. That's what gives me it's so rewarding to see that. And that's my personal favorite kind of patient to see, where I can help them.
Yeah.
Of course, I do all, like, internal medicine is such a complex, a broad.
You got to know a lot about a lot.
Right. But like, sort of, that's my niche.
Yeah.
A lot of my I have great partners. I work with 7 other, including me, we are 8 now. Like, they refer patients to me for weight loss. And they have their own specialties.
Yeah, I kind of like how you guys have little niches. Like,
Right.
I know that Dave kind of likes the musculoskeletal stuff.
Right. So I refer my joint injections and any kind of questions I have there to him.
Yeah.
But, I feel the work environment, the partners I work with, a great manager, she takes a lot of stress away.
Dave mentioned praises to
Allison,
her.
she's amazing. So I don't have to worry because I have young kids. There may be a day where I have to go for an appointment. There may be emergencies.
Yeah.
But she just handles them, but so calmly. So she takes that stress away. If you need it, that's there. And really, like you said, liking what you do. So most of my practice right now, just by default, it's heading towards weight. So I see a lot of patients now over last 3 to 4 years for weight loss.
What % of your practice would you say is that versus traditional internal medicine now?
I wouldn't say it's 50 yet, 40%.
That's awesome.
Yeah.
What was it 3 years ago?
15, 20.
So it's definitely trending up.
Absolutely. So I'm getting some referrals from outside my practice now. So we have few surgeons in our building. They send patients for example, a hernia surgery. They want them to lose weight. So they have been referring patients to me just to help them lose weight preoperatively.
Yeah.
Yeah. So that's what I enjoy the most. And I see myself doing more of that
As
in
time
future,
goes.
just focus on that.
And I mean, there's some great new medications too, right? Are all these
Absolutely.
meds like diabetes meds?
No, like they were started, the GLP-1 analogs, the initial indication was diabetes.
Okay.
But now we have like GLP-1 analogs. Are those the ones you're talking about, the injectables, the ones?
Yeah. Is that like Mounjaro?
Yeah. So Mounjaro, unfortunately, is not yet approved for weight loss. That's for diabetes. But I'm sure it will be soon. It's a great medication for weight loss.
Ozempic?
Ozempic is, Wegovy is. And then we have the Saxenda, liraglutide.
Okay.
That's a daily injectable. So in a different dose, like 3 milligram.
The semaglutide, like, is that part of this?
Semaglutide is both Wegovy and Ozempic are semaglutide.
Okay.
So just the different brand names.
So there's a, what's his name? Oh, it's Tony Robbins, right? Do you know or listen to him and his life force?
Yes, I actually, not recently, but actually a year back, I was listening a lot of his podcast.
Yeah. But he wrote a book and he narrates the first part of it. I did an audiobook. It's easier for me when I commute. And it's called Life Force. And he has all these other highly educated medical specialists, physicians, therapists that kind of look at just not just living, but living well and almost reversing the aging process as like, and a couple of things are like, they're talking about glucophage or metformin essentially being like a vitamin that a lot of people are taking and they're like, wow, I don't have diabetes anymore. Or my doctor says I don't have diabetes, but they have me on this med.
Right. Yeah, that's true though. Metformin, like if I know that the patient is pre-diabetic, they're heading towards there, they have a family history, we would start them on metformin.
And this is not what I do or what I prescribe, but it's a pretty safe medication, right?
Absolutely. Yeah.
I mean, low side effect profile.
Yeah. I mean, it does help with insulin resistance. It will definitely, if I can catch a patient early enough, there's no harm to it.
Yeah.
They tolerate it well. It prevents them. It may help them with weight loss, in fact.
Yeah.
And prevent that diabetes, which is, I mean, so
I almost think
dreadful.
that's right there, right? You've got diabetes, obesity, and just depression. Like there's a common denominator here, right? And they're all related to one another, right? Because these people are like, I lost 60 pounds and you know what? I don't have diabetes anymore. And like, wow, shocking.
Yeah, and more than that, it's the simple stuff they do. Like they can play with the grandkids. They can bend over where they tie their shoelaces. They don't get short of breath playing with the kids. They can walk up a flight of steps without short of breath.
Yeah.
Low back pain gets better. They can do yard work. I mean, just simple stuff they say just makes so much difference. That's what I think. Like when I'm older, I would want to play with my grandkids.
Oh my gosh, yeah.
Right? So those simple activities of daily living, I feel that where I feel the biggest difference.
Sure.
And again, in younger females, like I was saying, there's so much of their self-confidence, even socializing. I had a patient just tell me that she's going out with her friends again. Like she was just hiding herself.
Oh.
But that's what, the way it is doing so for me, it's not easy to just tell a patient that, hey, eat healthy and exercise. Because I've seen that, it's so great if a physician refers a patient to me. Because first of all, I give them some extra time, like I have longer visits.
Yeah.
Unlike someone else who may be just seeing them as a routine follow-up and addressing other issues. Because then you can really find out about the history, about that eating behavior, that nighttime eating that's going on. It's not just easy to tell them to stop eating.
Sure.
So that's where I feel like medications, I like to start medication right away, unless they have, of course, reason not to or contraindication. But then I just like to give it. And then when they see that difference within 4 weeks.
It's almost like a jump start.
Right. They feel amazing. That's when they start doing like, okay, fine. Initially when you tell them, okay, I've heard that before, doctor. Like, tell me something else. I've tried this. I've never lost weight. I regain it. But when they see that initial like, oh, wow, I'm actually seeing the numbers.
So, you know what just came to me as we're talking, right? Like you talked about the vicious circle or cycle of, depression and weight loss. And I'm going to throw diabetes in there too, right? And how it can snowball and you gain a little more weight, then this gets a little bit more out of control and you become more and more depressed. I see this in my joint replacement patients too.
Sure, yeah.
I'm an eternal optimist. So spin that snowball the other direction, right? Because once they give them that jump start, because momentum is dangerous, right? You get into a negative momentum cycle. You keep going down, digging deeper into depression or whatever. What if you can reverse it? But in order to reverse that snowball, you need that jumpstart of that medication because they need to see like quick gains. Like if it's going to be like, all right, it's going to take you a year to lose 20 pounds. If they can lose 20 pounds quickly, they're going to shift their momentum. They're going to feel better about themselves. They're probably going to be like, hey, I'm going to go to the gym. So now they're more active. They're going out socially.
Right.
Social life gets better.
Absolutely.
And then depression, hey, I got off my antidepressant.
And in your, like in surgical field, like, I mean, they can probably get to that surgery faster. And like I've had.
And safer, not necessarily, but like safer, right? Less chance of complications such as infection, wound healing complications, because they're either obese, diabetic, maybe they're a smoker, and they're malnourished. They're albumins,
Unfortunately,
minimal.
yes. But, if you look at the numbers in US right now, 42% of adults have obesity and 20% of children.
Wow.
So, and
I'm surprised the children is not higher, because when I look around, I'm like thinking it's much higher. You said 30 and 20?
42% adults are overweight or obese.
Okay.
And children.
And just for our casual listeners out there, can you just kind of give like the definition for overweight versus obese and explain kind of body mass index?
Yeah, so overweight would be like a BMI of 27 or more. And like normal BMI is up to 24.8.
Okay.
24 underweight would be below 18. Then 20, like anything up to 29.9, then it's actually overweight. But we can start weight loss medicines at a BMI of 27 and more. And if they have an obesity-related complication, such as like blood pressure issue, cholesterol, diabetes, sleep apnea, any of those. Obesity would be a BMI of more than 30. So just remembering those, like 26 to 29.9 overweight, and then 30 and more is obesity. Then of course obesity, we have stage 1, 2, 3.
So my simple numbers are 30 to 40 is obesity. Morbid obesity is 40 to 50 or 49.9. And over 50 is super morbid obesity. Am I missing, or is there subcategories?
So we refrain from using that word, super morbid obesity.
Because you're going to offend people? You're going to make them feel bad that they're really... And I'm not saying that to joke, but
right. No,
you got to call a spade a spade.
So we are doing like stage 1, stage 2. Stage 2 is up to 39.9. Like stage 1, starting from the beginning. Stage 1 is 34.9.
Okay.
And then 35 to 39.9 is stage 2.
Okay.
And then above 40 is stage 3.
Yeah, I'm an orthopedic surgeon.
Right. And you don't
30 to
have
40, 40 to 50.
You don't have to remember that, but I'm just telling,
Is this
whoever
gonna be on the test later, because I'm not going to pass it.
If somebody's listening here, and they want, if they are interested, because these medications are, I feel people need to have more information that medications are okay to use for weight loss. It's not a weakness if somebody's asking for medication.
I almost think of it kind of analogous to people taking antidepressants, right? And if you're just saying admitting you have depression, somehow in a previous era that was, you were weak. You couldn't handle with this on your own. Yeah,
with someone with an eating disorder, it's not you. It's basically telling someone with depression, don't be depressed, and you tell them don't eat.
Right.
So it has to be, and so these are medications actually that are helping more on your different neurotransmitters that they're working somewhere, decreasing your hunger.
Yeah.
So I do feel like more people would ask about it, because there is so much help, not just GLP-1 analogs. We have so many other medicines we have that are FDA approved. So, that's where my passion lies. Is weight and seeing my patients happy when I see them 4 to 6 weeks later.
Helps make you happy.
It's amazing.
Right. That's the same thing for myself. And that's what I think brings me so much joy, is not only do I enjoy doing what I do, but part of doing what I do is the stories afterwards, and right, just changing those lives. And a lot of times I'm not able to even see a lot of it because as surgeons, I mean, we're just we're so busy on operating that follow-up occurs with mid-level providers or nurses, or so I miss out on some of those success stories. But all right, I'm going to kind of morph into a business/personal question, right? Because it actually truly is both. So you are a physician and you are a female. How this is a unique from my perspective, because I'm a physician, but I'm a male. A lot of women out there that are watching this, they probably really, really look up to you, knowing that you are a mother of 2 young, active boys, a wife to a very active, successful OB-GYN doctor in Erie. We'll talk about Anand here in a little bit. But how do you balance those things? Because it's different when, and Karen can totally relate to this. She's like, the woman is the care provider. That doesn't mean that like I love my boys any less. Boys, if you're watching, and I'll come home and I'll cook like I did tonight and last night, and I'm going to do it this weekend. But how do you balance it? Because it's different for a woman that, and I'm not trying to stereotype, but you're the nurturer, right? They're going to almost always come to you first.
That's true.
So how do you do it?
Gosh, I've never thought of it. It's just, I've just done it. But maybe it's because I saw my mom doing it. It's just came easy to me because she worked full time, and I would see in the mornings her getting ready for work.
Yeah.
And before she left for work, she would still wake us up. Do our morning hours were a study time. She would sit with us, do our homework with us, like extra study. This is not homework.
Yeah.
Extra study. Like we would be ahead on our syllabus because she was a teacher herself. So she had to do that with us and then go for work later. So at this now, like I've always worked since I've had the kids. I've never had a year, frankly, where I was not working.
Sure.
So I've just been used to the lifestyle. Like Aryan was 6 weeks old when I started my residency. So I still remember dropping him at a daycare. And he was 6 weeks. He didn't know any different.
Right.
But I was, of course, tearful leaving.
It's like typical Indian. She signed him up for boarding school at 6 weeks old. No, I'm kidding. That's a horrible stereotype, but we can laugh about it.
But
right?
there's a story there too. Okay, since you say that, but I'll come to that.
Okay.
And then Arjun, I was a third-year resident.
And by the way, you're tapping them and being like engineer, with your Harry Potter wand. And
No, but I know my mom is. So I feel like kids get used to it because as a mom, it would be hard for me if my son came and told me, "Hey, I'm not getting enough from you," or if they said that this other mom is doing this and you're not doing this for me. So there are times that I do feel guilty, like I'm not able to go on field trips.
Will they ever say that?
Well, Arjun sometimes would say that I'm not going on field trips because field trips, like setting the locker, for example, happens on a weekday. Now, for that, if I were to do on a regular time, then you take time off for that.
What do you mean by setting the locker? Use that term this weekend.
So when the kids go back to school, before that, they can go and keep their supplies, school supplies ahead of time.
So it's a once-a-year type thing.
Right. I'm just giving an example.
Oh, okay. I was like, you're going in and organizing his locker every week.
No, but for kids, sometimes it can matter because their friends are setting it
Yeah.
that day and you are not. So I'm like, okay, let's do it on the weekend. We'll do it on the weekend. That's the day when you came and we were talking
like football,
about
right?
Yes. Yes. So, but like field trips, I'm not able to make it. Sometimes the class parties are there, holiday parties. They're all during regular hours. So I do feel I miss some things, but I try to make it up.
But that's the balance,
really
right?
And the kids know. So I'm so glad that they realize that. For Aryan, he tells Mom, "I'm so glad you're independent," or like he likes that. He likes that part of me now. So that's what happened with us growing up. Like I'm just used to that lifestyle. The kids know that Mom did not have a run this morning. She'll be irritable.
Yeah.
so
steer clear of Mom this morning.
So yeah, I mean
her running shoes have not moved. There's like a red bat phone that's flashing. Like Aryan, Mom didn't go for a run.
But jokes apart, the kids are like it's been well. I don't have a secret. How do I do it?
Yeah.
But I feel like I've just done it.
Well, you're a mom, and it's like, no, I'm not trying to steal any thunder from Nike, but you just do it. That's what moms do. And so much mad props to you.
Thank you.
All moms out there, especially working moms, right? It's not easy.
It's not easy.
And hey, single dads out there, I'm not trying to make you feel bad, but because you probably are,
True.
it's that same nurturing figurehead. We just don't call
Absolutely.
it mom for that.
Right.
So, but
Absolutely.
I think I take a lot of that stuff for granted because, I'm going to work early. So I'm like, well, Karen, she can take the kids to school, and then she can pick them up from school, and she can take them to their doctor's appointments. And I
Karen
wouldn't
is
even know
amazing.
where they
She
go to a
does,
doctor
yeah.
or their dentist.
I remember when I
know the
first
dentist,
moved
it's
to
true.
Erie, Karen had sent me this email, and it had all contacts possible, starting from
This is Karen
dentist,
Molly, by the way.
doctor, eye doctor, like house cleaning, you name it, and it was there. I mean, it was so amazing. Like she
Drew
is
Carlin,
great.
beautiful smiles, pediatric dentistry. He's my buddy. So shout out to Drew. But
No, I'm just talking about like, when.
all the
that's-
connections. Anthony Santoro. Do you know who he is?
No, I just saw that you interviewed him
Yeah.
recently.
His podcast dropped this morning, but young, successful. He's 28, owns the Bomb Shelter indoor training baseball facility. But
Wow. He looked so young. Like how he's in his 20s?
28.
Wow, that's
28.
great. Congratulations.
Yeah. No, I mean, he's very, very successful. But so you just kind of do what you do.
True. When you were talking about that Indian, you're going to the boarding school. So I have a story about being
let's
an
hear it.
Asian female doctor.
Okay.
And imagine moving to Meadville for my first job. So when I moved from...
Did you say Asian?
Yeah.
Yeah,
I'm Asian
so-
Indian.
I mean, I learned something recently too, because I would never refer to you as Asian. I would say she's Indian, but
Right.
it's part of
Absolutely.
Asia.
Yeah. So of course, when people see you, I mean, you have to. I am a first generation immigrant.
Yeah.
My parents are not from here. My kids are second generation here. But when I graduated from Allegheny General Hospital, and Anand was already working at Meadville, so that was just natural for me I have to go to Meadville. So I started out as a private practice initially, myself, and I had my partner. Her name was Jeanette Lee. She was an internist as well. So both of us started our own private practice.
From
And
scratch.
From scratch.
Wow.
Although I feel looking back, if I had done at this stage now, I would have been so much better at it. I was not quite ready for it
Yeah.
at the time. It's right fresh out of residency.
Oh my gosh.
Yeah.
There's a reason that it took me, 2018, like 7 or 8 years to start my own practice.
So
Wasn't the
first
right time.
patient here, first patient walks in. He's this white 70-year-old male, about that, and he sees me standing behind the receptionist. Okay, so he said, she said, okay, is she the doctor? Yes, she's the doctor. Does she know English? So that's it. So my partner.
Oh my goodness.
So my partner, Jeanette Lee, she was great. She was older than me, slightly more experienced. And she was right there standing. She opened the window. Yes, sir, she speaks the British English. Because in India.
So it's much smarter and more educated.
It's just a funny, I've had stories like that. I've had those... people have biases. I mean,
Yeah.
and then there's nothing you can... I have biases too. We cannot help it.
Whether or not
But-
you want to admit it, right?
Yeah.
We all have that.
Everybody does. So, but if anything, he was one of my best patients. Frankly, he became my patient, and he was great, funny guy. We had so many so.
Would
just
you joke about
stories-
it?
Oh yeah.
When he would come in,
absolutely.
did you ever
Absolutely.
pretend that you didn't speak English?
No.
You should have played with him.
No, maybe you're right. I should have, but I was just a frankly, graduate.
Yeah.
And now if I have patients like that, I mean, we joke about it. That's not a problem,
How
but
in the world did you start a practice when you just came out of residency?
I know. I don't know why did I do that.
Did your partner have any experience either?
Well, she did in New York, though.
Okay.
And her husband, they were only there for a short time because her husband, he was
In
hired
New
as
York?
In
Or in Meadville?
In Meadville, they were
Okay.
for a very short time because her husband was interventional cardiologist at the time,
Got it.
and she was just doing this as so both of us were there because of our husbands, I think.
Was the husband's thing only like a temporary thing?
Yeah, he didn't stay long. I don't
Okay.
think.
But it wasn't planned to be temporary. It was
Not
just,
planned to be, yes.
Okay.
But yeah. But I miss her. I think she's somewhere in North Carolina now. But
Nice.
but she was just her response.
is she private practice now or employed?
Employed.
She's employed. So you're both employed. So how many years did you do that?
It was about actually 3 years.
Okay.
Yeah. And I didn't do so bad, actually.
Yeah.
Looking back, I mean, of course, there are things I could have done differently. But now if I were to do it, so on this, because of the same reason, because I've never been good. As a physician, you're never taught business side. I mean,
Ever.
so
Ever.
and that's another, impressive, like so impressive what you have done. Just learning the business, the numbers.
Yeah. That's
Like,
all.
Right. And how I
Didn't
get
take
those,
any classes. I didn't go. Like I know you said you're studying for your MBA.
right. So that's I started summer 22.
I've thought about doing that, and then I'm like, when would I do that? Because it's going to have to. Something else is going to have to give. And I'm not saying because I would learn a tremendous amount. But I think there will be a time in my life when I can do that when things maybe slow down a little bit.
Yeah. I think though you're learning so much, like on hand learning
On the job.
there, really, that's
You're like, well,
that's the best
that
kind of
didn't
learning.
work. And then learning by failure is by far and away the best way. It's painful, but it's really good. So the next thing that we typically do is we do what's called the 7th inning sawbone shoe stretch, right? So
Okay.
asked you to wear either one of your favorite pair of shoes or shoes that have a special story or meaning to you. So, and then I'll do the same thing. So fire away.
Well, that's my running shoes, hands down. I just, that has most meaning to my life. Just same thing, the same level, like the stressors in your life. And for me, I feel this is a sort of symbol that just calm among chaos kind of feeling.
Mm-hmm.
That if I put these on, go for a run by myself. And I run by myself. I do train with partners sometime, but normally I run by myself. But that's the time I really feel I can find solutions. Because my older one is in high school right now. There'll be things I'll be thinking about him, what's going on in the school, how can I help him here, or just that movement. I feel. Other thing that helps me is with this would be, and this is for my other female friends as well, if they're watching, because I do feel that's form of a self-care for me. Because I have to do that for me so that I can be a better person at home.
Yeah. So you can be a better mom,
right?
better wife, better physician, all those things, right? It's not selfish when you're taking, and that's something that needs to definitely be taught.
Right.
Especially amongst physicians.
And it
because
took time for me to realize that.
Yeah.
And initially, I would feel guilty about it. Like, okay, that needs to be done. But now I just think that that's so essential. Like that sort of a symbol of that for me, self-care, sort of empowerment, confidence, calm.
I'm loving where this went. Never would I have thought that, but this is, you think like, oh, it's a shoe conversation. Like, what's so special about shoes? Well, you saw Dave Hutzel's podcast.
Yeah.
To date, I think that was Karen's favorite podcast. And his title was called It Is Solved by Walking or Through Walking. And you're telling the same story, but it's a little different for you. It's running. The key is it's by yourself. So for me, self-care, I love going to the peninsula. Like I've been going regularly, like at least once a day, if not every other day. And I'll do 6 miles, just walking though, because I can't run anymore because of my hips. But it's the same thing. Is a couple of years ago, I would have looked at that as, oh, that's time I could be spending with the boys. That's selfish. Right. I think physicians too, like we have this, I'm not trying to sound like a martyr by any means, but we have this almost mentality that is beat into us as like servant. You have to be a servant to all of your patients. And I think our patients expect that too. But when you start hearing that the highest suicide rate in this country by professionals is physicians, and for me personally, it's 28% of those are physician suicides are orthopedic surgeons. There's a problem.
That's shocking.
Right. And you got to get to a solution. And to me, it is like doing stuff for yourself. I get regular massages every couple, and I pamper myself. I do a 2-hour massage every 2 weeks because it helps to relieve tension from my day job of wearing a heavy helmet, and my walks are essential too. So, and meditation. I don't know if you practice any form of meditation. Maybe that's while you're running. I don't know, but
Right. I feel that's a form of meditation for me. So far, I've not done the still meditation.
Yeah.
For me, action movement has always worked better. That's what I feel. I need to start my morning. But I do feel evenings slowing down. That's the time I could go for a walk, like just slow. But just I think better when I'm doing something.
yeah.
Like I would be so bad at just sitting and thinking about a solution sitting,
Yeah.
as opposed to if I went for like a little jog.
I'm the same way.
It would come to me.
Creative juices get flowing much
Right.
better during those
Right.
times of activity. So, well, I'm excited to talk about these. So, obviously, every episode, anybody that's watched.
That Jordan wall. That's amazing.
Yeah, so she saw my Jordan shoe collection. By the way, my Michael Jordan number 45, 45th pair of Jordan shoes came today.
Oh wow.
They're not these. They're not
okay.
these, but in commemoration of my 45, Michael Jordan, for a short phase of his career, he wore number 45 for a couple games. And then he wasn't as good. And one of the players, Nick Anderson of the Orlando Magic, said, well, number 45 isn't number 23, making like an implication that he wasn't the player that he used to be. So
Okay.
Jordan was like, screw you. Even though my number hangs in the rafters and it's already retired, I'm taking it out of retirement, just like I came out of retirement. And he came back with a vengeance. So these are my Jordan 45 shoes. They're the Jordan 4.
Okay.
And these are the bread. By far and away, my favorite pair of Jordan's design colorway
Oh, no.
ever.
That's
So
amazing.
I've always loved them. Time changes. Like I used to hate the Jordan 1s. Now I love the Jordan 1s, but these are the 4s, and I love the mesh here, the big Jumpman logo here, just the colorway. They brought some grays in
Color
here.
combination.
Yeah, and then these kind of cool lace straps here, which are gray.
Do the
and then
boys
obviously,
like these?
oh, the boys love Jordans. They all have multiple Jordans, and
That's
great.
great.
Luca. It was cute. There was a box, and I got home. I said, "Karen, is that shoes?" I still get excited, and she goes, "Oh yeah, it's shoes." And then I came down, and Luca's like tearing open the box, and he goes, "Shoes, shocking." And then I open it up, and it comes in the Stadium Goods. He goes, "Stadium Goods, shocking." Open up the Stadium Goods, and it's a Jordan box. I go, "Ooh, Jordans." He goes, "Another pair of Jordans, shocking." And Luca's 8. So
That's what is that? Who said this quote? I think good shoes take you good places.
I don't know. I love it though.
You're right. So it's I forget. It's a actress or like something
Wow.
about. So I love that. I love shoes as well. So
What's your shoe collection? I mean, what is it? Mainly like dress fun shoes?
Yes.
Is it sneakers?
more
Is it
dressy shoes.
combo?
I would have like both,
Okay.
running shoes, of course, that's a different category. Sneakers.
Yeah.
And then biking. I recently gotten into biking. I love biking, although I'm not good at it. But again, I'm getting used to the idea that it's okay to like something and not be great at it.
I mean, you'll get better at it, just like you
Right.
do with everything, right? I mean, you're doing triathlon, so it's a part of that.
So, but yes, I do enjoy dress shoes. I love dressy shoes.
So, do you have any Jordans?
No, I don't have Jordans.
Archana, we got to get you into a pair of J's. So, Karen got her first pair.
Oh, really?
Yeah, she got some Jordan
I would love to
ones.
see Karen wearing those.
She'll probably be home when we're done here. You'll be able to see it. But
Love it.
so the next part is always kind of a fun. Hey, we're almost done, kind of wrapping it up, and it's the Sawbones challenge. So you've seen this before, right?
Oh, the basketball?
Yeah.
Yeah.
So
yes. I did
you know,
see that.
your partner, Dave Hutzel, he gave me some feedback. He goes, I think you should do it so that your Sawbones challenge is a little bit more of a challenge, and like implying that it wasn't fair that we're doing my sport. And I was like, in my head, I'm like, well, Dave, this is my podcast. I'm going to do something that I can win at, right? By the way, Matt Zim is the only person that's ever beat me.
Really? I'm definitely not winning. So
No. So we're going to do something to appease Dave. I'm going to give
Okay.
you a choice. Plus, it's probably pretty dark outside. So we have a small mini hoop, which Anthony Santoro and I, we played pig on that.
Okay.
There's the Papa Shot, which is 2 basketball hoops. And you don't have to decide right now. We'll go out. We each shoot at that. And the first one to make however many wins.
Okay.
So you've got some options.
Sounds good.
Okay. So everybody stick around. We're coming right back after the Sawbones Challenge. And it's going to be fun.
Ladies and gentlemen, welcome to the main event.
All right. Sawbones Challenge. We're going basement version again. Last time it was with Anthony Santoro. It was pig on the little breakaway rim. Tonight we're doing Papa Shot. So similar to what we do outside, it's going to be kind of our indoor 3-point competition. But we're going to do it till 10 just because going to 5 I think would be too quick. Okay, we're going to do alternate shot. So fire away.
Let's do it.
Okay, here's Archana. We're going to call her Arch.
Ryan, like literally, you just.
Well, if you put me in a swimming pool, it would be like the same because you would be swimming laps around me. So 1-0. Oh. She's got the bank.
Okay,
These
that's-
doctors and their bank shots. Matt Zim, all he did was bank. He beat me.
Wow, how many did you get?
2-1. I think it was 5-3. So it wasn't even like, it wasn't 5-4. Oh, so we got 2-1 still.
Oh,
She's getting frustrated. Oh. I feel like you're just gonna catch fire here, Arch, and it's gonna be over.
still 2-1.
2-1. This is Jay. We're gonna have you edit the Pop Shot. Maybe we should go to 5, but we're good. All right, 3-1. There you go, 3-2. I'm liking it.
3-2.
Ooh, here she comes. Ooh, I have a feeling that you're like competitive. Are you? You don't like to lose,
Well,
do
I
you?
am. I'm definitely. I like to think I am.
4-2. So 5-2. Oh. There it is. 5-3. I think you gotta just focus on the bank. It's working for you. 6-3. 6-4. 7-4. Oh! 7-5. 8-5.
No.
6. 9-6.
Oh no! Oh,
You had a rhythm too. You had a rhythm.
oh, I didn't make it good.
There it is. Sawbones Challenge,
Oh, that
basement
was fun.
version
I need to
2.0.
practice.
So,
yes.
but again, you put me in a swimming pool, you were gonna literally swim laps around me. So, thanks everybody. We'll catch you back down for the closing here in a little bit. Welcome back, everybody, from the Sawbones Challenge. So, at this point, conclusion, right? I always ask some questions, kind of like, where do you see yourself in 5 or 10 years or 15 years? I mean, I think the first thing that most people think of, especially in our situation, is like, well, how old is Arjun? So you start to do some mental math, but
Right.
where do you see yourself in 5 to 10 years?
Oh, boy.
Professionally and personally?
Yeah. So right now I'm doing this MBA just to understand more management side. I wish I knew about these things before, but now this is really helping me and getting me interested in more management, administration side as well. I do want to continue my obesity practice. So I feel like a combination or maybe even a private, like an obesity
Clinic?
setup
Yeah.
with a dietitian on board, even like a small connected, not a huge like gym per se, but something to show people certain movements that they can easily do.
Not like here's 60 treadmills, but more like you could do this. Here's a assault bike. Here's some cable systems. Here's some free weights. Here's some dumbbells. Here's some kettlebells. Here's some yoga mats. Here's some.
And then I would love to have a counselor on board for just that, because the mental health is so much more connected with the eating, like addressing the eating behavior. So the combination of that, I would love to have a practice like that. And I do want also to address some of the teenage issues there, especially girls, when I see eating disorders, especially anorexia, bulimia. And because that's another, although I don't see patients 18 and younger, but
You see their parents.
Right. But I've had actually girls in that age, 18 to 20, that I have worked with. And I feel in our society, there's still more awareness about weight and obesity, but not so much about eating disorders, anorexia. I wish there was more awareness about it. Because if I see a teen girl, 18, and she's very thin, we start making judgments already in our heads, right? Like, oh, she's just not eating to lose weight. So I also want to work there. It's like a little like part of my practice. Again, I feel that would need me to see more patients like that, but my main focus would be on health and weight, both under and overweight.
Well, I mean, you're already doing it. I think you're going to continue to grow, and your vision is going to be sought out. And I totally see you doing exactly what you want to do. And I'm honored to kind of share a similar vision with Whole Health, and particularly proud of like one of our latest accomplishments with the Wellness Institute. And it's a lot of the same stuff, right? Like taking these patients and really focusing on optimization before surgery. And I'm not saying like 2 weeks before, like, hey, stop smoking, cut out the potato chips and your French fries, and we'll do your surgery. It's like we're putting a tremendous amount of time and effort and energy into a screening protocol, which may be a little frustrating for patients right out of the gates, but they have to understand that the end goal is to get them the best surgery possible done on the optimal patient at the optimal time. You can't have this success without, you can't skip steps, right? So getting people enrolled into the Wellness Institute, focusing on whatever it may be. And it's oftentimes a combination, right? Weight loss, diabetes control, malnourishment. So we're getting labs before they ever meet the orthopedic surgeon. That's one of our new protocols. And we're getting an EKG and just trying to pick up on, because there's nothing worse or more frustrating to patients than like the day of surgery, the day before, like, ooh, we need a cardiology consult, or like, how does that happen? This should be happening not even weeks before, but months in advance. People don't decide, I want my knee done tomorrow and it gets done tomorrow. It's a process.
Right. And plus, when you are, like I said, in touch with every point, it makes it so much more efficient. Like, what's happening with that patient. The patients love this process. They love what they're expecting. They love watching the video, the introduction, I believe, when they go to your office. They learn about the whole procedure. Like, whoever I have seen as a follow-up, they have been really like wowed by your practice. So
well, thank you for the kind words, and hats off to you, because I have a tremendous amount of respect, admiration for you.
Thank you.
Your partner, Dave Hutzel, all of your partners. You have an amazing practice.
You do.
I love, again, your niches, but you're doing what you love and you're doing it really, really well. And that's like the beauty of things, is like when people really enjoy what they do, they tend to do it really well. And then it's that cycle again. Then you enjoy it more because your patients are happier.
Yeah.
So.
Yeah, I feel lucky to be in that practice. Like, that's one of the reasons I never feel stressed or, thankfully, burnout.
Yeah.
Yet.
It's doing things with people that you enjoy doing it with, right?
Yeah,
so,
absolutely.
Well, thank you so much for joining us, taking time. So it's a Wednesday evening. You're taking time away from your family. So I want to, again, applaud you for everything you've done personally, professionally, and this means a
was
lot.
great. Thanks for having me.
Sharing your
Wonderful.
story.
Yeah, absolutely. This was great. Thank you.
Yeah.
I
So
enjoyed it.
stay tuned. What we're going to do is we're going to show you a little teaser for next week's guest here in a little bit. But as always, I want to thank everybody. Make sure that you subscribe. Archana, make sure you share this with your friends. Tell them to subscribe. Leave comments, leave suggestions, leave requests. I honestly got my first email request of somebody that thinks I should have this particular guest. Cool. Bring them on.
That's great.
Yeah. And
That's
it's actually the
wonderful.
father of one of my friends. And he suggested a person. I'm not going to say any names yet because I would like to approach them and ask them.
For sure.
But a person I never would have thought of. And I may ask this person and they may say, no way, no how. But as we talked earlier, right? You don't know until you try.
That's true.
Ask that question. So
Absolutely.
stay tuned. Trailer coming up next. And we'll see you next week. Have a great one.
Well, first off, I want to say that if I had my warm up, I might fit around my arm right now. At this point, in my life.
This is tight. I know. We've all gotten bigger. This is tight, so don't let it fool you.
No, not at all. Not at all. I can. It's a little cold in here, obviously.
Wow, the gloves are off. This is going to be a good episode, by the way.
It was that year I was a freshman, and you were a sophomore, and we were playing at Union City, and at that time, I don't think either of us made it into the rotation quite yet, and the JV game was over or whatever, and we're sitting there and we're watching the varsity game, and Ashley Orris starts lighting it up. And the whole time we're like, there's no way he didn't just take that shot.
Was this the game where he scored 49 points on us?
Yes. He scored 49. And literally, I remember at the end of the game, we're both looking at each other like, what do you think he had? And I'm like, you looked at me, you're like, I bet you had 25. And I'm like, oh, yeah, I bet you had 20, maybe 27. And then we saw the box score.
We were off by 20, almost 25 points.
What opportunity? Because, opportunities are all about timing. Sometimes timing doesn't work. Timing is actually probably one of the most important things that
I think timing's everything.
Right. So what opportunity did you miss out on that you regret?
Oh gosh. The NBA.
Well, that wasn't a timing problem, buddy. I love you and all, but that wasn't a timing issue.
It was. I wasn't quick enough. I wasn't fast enough. I couldn't jump high enough. It was just timing. I hit my peak a little later, Ryan.
Yeah.
You just didn't realize that.
Well, just look down, give me 40 days. Still find I could not pay. Said walk right soon be home. Cross the line when you're wrong. 40 days. Shine on by wild fences. 40 nights sit listen to that midnight train of Memphis. Tell me all about it, Doc.